Hi, I'm Darrell McDannel. I treat physical and vestibular therapy services at Occupational Performance and Rehab in Marion, Illinois. And I want to talk to you a little bit today about the anatomy of the inner ear and its association to vertigo, bed spins, room spins, those types of things. The inner ear is actually about the size of your thumb. You have one on each side. They operate independently of one another. So whenever one of them is telling the brain some information, the other one could be telling the brain totally different information. This can obviously lead to some disorders that are very uncomfortable to my patients. It can cause nausea, obviously room spins and bed spins, and they'll tend to kind of stay home and not do things because they're afraid they'll have a vertiginous attack. The anatomy of the inner ear that drives this is the otoconia. The otoconia is inside the utricle and sacculae area of the inner ear, which is a dry socket area. These are actually little bone chips with a tacky coating to the outside of them, and their job is to kind of stick together, clump together, and form a little ball, and kind of work like the bubble on a level as far as giving information to the brain about where the body is in space. So one of these deals with propulsional component, the other deals with a rotational component, and as they move, they feed through nerves to the brain, tell the brain movement's occurring. The brain simply tells the eyes, go find that movement so I don't fall down. Now, when everything's right in the world, that's great. A little bit of movement, a little bit of pivotal movement in these sockets is not much for our brain to have to deal with. But if they get displaced into one of these three semicircle canals, then it has a lot more room and opportunity for movement, and your symptoms will increase. There's a little cupula flap in the wide section of each one of these three semicircle canals. It's pictured here. And that can be irritated, open up, and that vestibular nerve can be very irritated by that movement and give you what we would call cupulolithiasis. Treatment for this would be to migrate these crystals up and over the top of these semicircle canals and get them to drop back into the utricle and sacculae where they're supposed to be. This is done using our infrared goggle system and a maneuver called the canalithic repositioning procedure, previously called an Epley maneuver, and it has a very good success rate. So as we move these up and over the top and we get them to drop back down in here, that's all possible because there is not a cupula flap on the other end of this semicircle canal. Now at that time, fluid, the otoconia or the rocks are going to be all in this area. It's going to be kind of like a snow globe shook up. Okay, so we're going to use a post-treatment protocol to stabilize the head for a little while and let those rocks collect and stick together. And then you should, in a very short time period, see your symptoms decrease. That is then followed up on by physical therapy in order to make sure that you're not susceptible to a fall. You have the proper muscle strength and gait patterns to avoid any fall whatsoever.
I had surgery about a year ago, and when I came to in my room, I was real dizzy. I had vertigo, the worst. And so I came home, and for 3 months, I didn't think I'd ever be any better. But there's a doctor sent me over here to Dizzy Darrell. You gave me the treatment. I went home, and I didn't have any more trouble. I haven't had any falls. I don't even come near falling. I just get up out of my chair like I used to before my surgery, and I don't even think about falling.
I had been having symptoms for about 8 years on and off, and recently the symptoms were coming more frequently of the vertigo symptoms, and I noticed my balance and coordination were getting worse, and that's why I wanted to come in and do some treatment. And you did a consult, and we looked at my body strength, my posture, my ankle strength, and started making some adjustments in all those areas. I had no idea what I was getting myself into when I came here. I didn't know that such therapy existed, and I wasn't sure what we were going to do, where we were going to go with this. Once I got here, some of the things that I realized was that because of my balance issues, my posture was completely off, and so I was slumping. My head and neck strength weren't very good because of that, and we worked on that. We worked on my gait, and I'm still working on my gait because evidently one of my legs was swinging because of the balance issues. And so I've been working on that a great deal.
I've had vertigo patients that, are totally disabled basically by this illness, and they're staying at home and unable to get out, and that can really play on a person's emotions. And I'm glad to say that we've been able to help that person get back into society, and it's been more than one. We've done that several times.
Dizzy Darrell has a great staff. I just loved every one of them, and they were so good to me.
Yeah, I'd be glad to recommend Dizzy Darrell and OPR for this kind of work with vertigo, because I think it's been extremely beneficial to me.